Hello guys, so today we will be learning about hyperplasia, metaplasia and dysplasia. But before going in detail, let us just revise about different kind of cell adaptations that we did in the last video. So what are the different kind of cell adaptations? Atrophy, hypertrophy, hyperplasia, metaplasia and dysplasia. We can always refer to this diagram for a better understanding. I guess we are well versed with the basics, so let's move on to the hyperplasia in detail. So before starting on, let us just see this fun diagram. So this is a cell, it undergoes hyperplasia and it increases in number. Yeah? So that is only basically hyperplasia. It is increase in number of parenchymal cells of a particular organ or tissue. Like we said in the last video, usually hypertrophy and hyperplasia goes hand in hand in dividing cells. If you remember from the last video or if you have read, let me know in the comment below what happens in non-dividing cells. What are the different kind of cells that undergo hyperplasia? These are labile cells and stable cells. Example of labile cells are epithelial cells of skin, epithelial cells of mucous membrane, cells of bone marrow, and more so. And the stable cells are nothing but parenchymal cells of already developed organs like thyroid gland, adrenal gland, kidneys, pancreas, liver, etc. So now we know what hyperplasia means. So let's go on to etiology of hyperplasia. Etiology of hyperplasia is again physiological and pathological. In physiological, there are two causes. One is hormonal cause and the other is compensatory cause. Example of hormonal cause we can understand through breast and uterus during pregnancy and lactation. So what happens is when there is a pregnant woman, her uterus not only increases in size to adapt the baby inside, but also the cells of the uterus increase. Same occurs with breast. During lactation, not only the size of breast increase, but the number of cells in the breast also increase. Since these are dividing cells, there is hypertrophy as well as hyperplasia occurring together. In compensatory hyperplasia, the basic example of this is marrow hyperplasia after blood loss to replenish the blood. Let's move on to the pathological cause of hyperplasia. It's nothing but excessive stimulation. But excessive stimulation of what? Excessive stimulation of hormones and growth factor. No, not girlfriend. Growth factors. On the target cells. When we move ahead, we will learn about how does this cause or lead to hyperplasia. But the best example of this would be ductal hyperplasia and the prostate hyperplasia, as we can see in this diagram. So let's move on to the morphologic features of hyperplasia. If the organ has undergone a hyperplasia, it would be enlarged and the number of cells would be increased. And the molecular mechanism finally. So in molecular mechanism, as we read above, that excessive stimulation of hormones and growth factor leads to hyperplasia. But how do they act? They act on the receptors of neighboring cells. And then the neighboring cells tend to proliferate. And this leads to hyperplasia. So I hope the basics of hyperplasia is clear. So let's move on to the next topic known as metaplasia. Metaplasia, as we talked about earlier, we said that it was transformation. But transformation of what? It is transformation of one adult cell type to other, but only if an abnormal stimulus is present. The most important thing to remember that metaplasia of any kind is reversible if the stimulus is removed in time. Metaplasia are also of different types. Types of metaplasia are epithelial and mesenchymal. But epithelial metaplasia also has two different types that are squamous epithelial metaplasia and columnar metaplasia. The squamous one is the most common. Let us understand how this works. In theory, it is XYZ cell epithelium under stress changes into squamous epithelium, like columnar, pseudostratified, anything changes into squamous epithelium to protect itself. Let us understand this theory with help of an example. So, in bronchus, as we all know, the basic or the normal epithelium is pseudostratified epithelium. But in a person who is a chronic smoker or inhales a lot of tobacco, the pseudophyte epithelium changes into squamous epithelium to prevent the bronchus from further damage. So that is about squamous metaplasia. Next, we move on to columnar metaplasia. Columnar metaplasia is again the same as squamous metaplasia, but in this, any cell epithelium changes into columnar epithelium under stress. Let us understand this with the most common example present, that is the Barrett's esophagus. The esophagus usually has squamous epithelium. Wait a second, squamous epithelium. But when there is acid reflux from stomach to esophagus, the squamous epithelium of esophagus gets converted into columnar epithelium. But why does it get converted into columnar epithelium? Because columnar epithelium secretes something called as mucus, and mucus protects the esophageal lining. So this is about epithelial metaplasia. Next we go on towards the mesenchymal metaplasia. Mesenchymal metaplasia again is divided into two types, osseous and cartilaginous. Osseous is nothing but development of bone in place of tissue other than the bony tissue, like in cartilage or mucoid tissue or any place else. And cartilaginous usually helps in fracture healing, cartilaginous metaplasia. So that was the basics about metaplasia. Next, we move on to last but not the least of the cellular adaptations, the dysplasia. Dysplasia is also commonly known as atypical hyperplasia. Since in hyperplasia there is increased number of cells but in an organized manner, here the order is random. So that is the basic definition of dysplasia, that disordered cellular development. The most common type of dysplasia is epithelial dysplasia. And it has its own characteristics. So the basic characteristics are also given in textbook that I have written down here. But the most important ones out of these that I feel are the basal polarity. What is basal polarity? Basal polarity is the nucleus shifts away from the basement membrane. Example, this is in columnar epithelium. Okay, so here columnar epithelium, it has nucleus situated towards its base, but when it loses its basal polarity, it just shifts away from the basement membrane, and that leads to dysplasia. There is also cellular pleomorphism. As we all know, each and every cell is characteristic in nature and it has its own peculiarities. But when there is loss of those peculiarities and nature, it is known as pleomorphism. That in layman terms is lack of individuality of own. Then there is also increased nucleocytoplasmic ratio. The cytoplasm tend to acquire less space, it degenerates a bit. I guess degenerate is not the right word, but the nucleus occupies more place in epithelial dysplasia. And there is also nuclear hyperchromatism. So when we stain a cell, the nucleus gets densely stained than it would normally do in a normal cell without dysplasia. So what is the cause of dysplasia? Why does the cell undergo a dysplasia? It is due to chronic irritation and prolonged inflammation. And where do this inflammation and irritation most commonly occur? The uterine cervix and the respiratory tract. These are the most common and most vulnerable places for dysplasia to occur. But is dysplasia reversible? Of course it is reversible since it is a part of cellular adaptation. But there is an exception. Only if the stress is mild. If the stress removed, it goes back to normal. But if the stress is prolonged and severe, it does not go back to normal, but other than it goes into carcinoma in situ. What does carcinoma in situ means? Carcinoma in situ is basically that cancer is confined to the layers superficial to the basement membrane. So that's about today. Today we learned about hyperplasia, metaplasia, and dysplasia. I hope you liked the video and understood what these three are. If you have any doubts, feel free to comment in the video below. And thank you.